The more common problems or pathology that I deal with, heart and lung diseases are obviously different. With the heart diseases, patients may come with the problems with the coronary arteries when they become narrow or they block off and the blood supply to the heart muscle is deficient. People end up with heart attacks or problems with the heart, so the coronary artery bypass graft surgery is one of the commonest performed by many surgeons, and certainly I have a lot of interest in doing that. At times people come to the rooms, but pretty frequently patients get admitted with heart attack or problems, and while the inpatients I operate on them. The valve problems, the mitral valve regurgitation, the aortic valve stenosis, that would be more common pathologies. So the valve, particularly the mitral valve, we always try to repair it whenever possible. And the aortic, depending on its condition, can be either repaired or replaced. The aortic root or aortic ascending aorta, or first part of the ascending aorta, can be dilated and it may need to be replaced with the graft to make sure that it doesn't burst, either from aneurysm or dissection. The common pathologies I deal with, again, I do provide the surgery for irregular heartbeats and atrial fibrillation and removal of left atrial appendage, just the sac that is on the side of the heart that is removed to reduce the risk of stroke for people who have irregular heartbeats. And with the lung pathology, I do deal a lot with the lung cancer. Certainly when the lung cancer is quite in early stage, there is a curative intent. I do a lot of surgery to remove parts of the lungs containing the tumors, and really that is not acutely but longer term certainly a life-saving surgery. People may be admitted with the collapsed lungs, with pneumothorax, or with infection around the lung, so-called empyema, when pneumonia gets out of control and there is a collection of the pus around the lung, and people require the minimally invasive surgery. And again, everything I try to do with the chest, with the lungs, minimally invasive, to clean this pus and infection, and that's another lifesaver for the people. Some patients come with collection of the fluid around the lung or heart, and then I surgically drain it, and I provide the procedure which prevents from any further accumulation of the fluid. A lot of diagnostic procedures, getting the lymph nodes from the chest by various surgical means. If there is a mass or lump behind the breastbone somewhere in the chest, I remove them, and again minimally invasively or robotically. These are probably the main diseases that I deal with. But if there is something new comes my way, I speak with the experts and just see whether I can do it myself or with another surgeon to broaden the horizons.